Hello, my name is ARuwe. I'm a Maryville University Family Nurse Practitioner student, and today I will be completing my head-to-toe examination. This is my volunteer patient, Michaela. Before beginning our head-to-toe examination, I had her change into a gown. She then emptied her bladder. I checked her vital signs, her height and weight. I also tested her near vision with the Rosenbaum chart and her distant vision with the Snellen chart. These were both testing cranial nerve 2. I will begin my assessment with her head and face. I'll first start with inspection. I'm looking at her face, making sure that her eyes, nose, mouth, and ears are symmetrical, that her head is midline. I'm then looking at her skull, making sure that there are no masses or lesions present. I will then move on to palpation of her skull. Any tenderness here? I'm ensuring that her skull is normal cephalic and that it moves freely. I am then looking at her hair, making sure that it is evenly distributed throughout her scalp and that I'm noting the texture. I'm then going to move on to palpate her facial bones. Could you tell me if you feel any tenderness as I do this?
No.
And now I will palpate her frontal sinuses and maxillary sinuses. And do you feel any pain there?
No.
Okay, I'm now going to move on to assessment of her temporomandibular joint. If you could open and close your mouth for me. Here I'm checking for any clicking or popping, which would indicate an abnormal response. Now I'm going to do a series of facial tests, testing cranial nerve 5 and 7. If you could please raise your forehead, close your eyes, puff up your cheeks. If you could smile, clench your teeth, stick out your tongue, move it from side to side. Okay. And then now I will be doing her light sensation test. I'm going to touch this point at both your forehead, your cheeks, and your chin. If you could just tell me if you could feel it evenly.
Yep. Yep. Yep.
And once again, these tested cranial nerves 5 and 7. I'm now going to move on to the assessment of her eyes. I'm first assessing her eyebrows, making sure that they are full and evenly distributed and that they extend to the outer canvas of her eye. I'm then looking at her eyelids, making sure that they do not show any signs of redness or edema or dryness. I'm then looking at her eyelashes, ensuring that they're evenly distributed throughout and that they extend outward and upward. I'm then going to be looking at her iris, conjunctiva, and retina. I'm going to shine my pen light, noting that I don't see any jaundice, redness, drying, or excessive tearing. I'm then going to palpate the lacrimal apparatus, noting any nodules or pain or tenderness. Any problems? No. Okay, great. I'm now going to check her pupillary response using my pen light. Michaela, if you could please fix your eyes on the wall over there. And then here I will be checking both the direct and consensual reaction, ensuring that her eyes are equal, round, and reactive to light. Okay, great. I'm then going to move on to the cover and uncover test. If you could please cover your right eye. Here I'm looking at her left eye, ensuring that there are no involuntary movements, and then uncover, please. And switch to the other eye, once again looking for any involuntary movements of her right eye. I will now look at the extraocular movements of her eye, ensuring that I see no nystagmus. If you could please follow my pen light while keeping your head very still. And here I'm just making sure that her pupils are moving evenly. I'm now going to move on to the red reflex. I'm going to be using my ophthalmoscope for this, and I'm going to be standing 30 centimeters away. At this point, I will be looking at the red reflex, and as I get closer, I'm going to be looking at the branching of her blood vessels and her optic disc. If you could just look straight ahead for me. Okay. And I would then repeat that on the other eye. This is testing cranial nerves 2, 3, 4, and 6. I'm now going to move on to the assessment of her ears. I will first inspect, looking that her ears are symmetrical with her eyes and that they're midline. I'm looking for any notable lesions or masses. I'm then going to palpate her ears, making sure that they move freely and that there's no tenderness. Any tenderness here? No. I'm going to now use my otoscope, and I'm going to be looking into her ear canal for any excessive cerumen or redness or tenderness. I'm going to pull your ear back and up, and I'm going to be looking down the ear canal into the tympanic membrane, looking for a pearly gray substance. I would then repeat that on the other ear. I'm now going to complete a series of ear tests. The first one would be the whisper test. So I'm going to stand behind Michaela. Michaela, can you please repeat this word back?
Apple.
Okay. I will next be moving on to the Weber test. I'm going to take my tuning fork here, and I'm going to strike it on the palm of my hand. When I place it in the middle of your skull, if you could please tell me that you could hear the vibrations evenly on each side.
Yes.
Okay. Next, I will perform the Renee test. I'm going to once again strike the tuning fork on my hand. I will then be testing both air conduction and bone conduction. I will place this at your mastoid bone, and when you can no longer feel the vibrations, please tell me. And then when you can no longer hear the vibrations, please tell me. Okay. Air conduction should be 2 times greater than bone conduction. These are testing cranial nerve 8. I am then going to move on to the assessment of the nose. First, I will be looking at her nose, inspecting for any evidence of trauma, any lesions, that her skin is intact. I'm then going to have her tilt her head back, and I'm going to look into her nares, making sure that the turbinates are moist and pink, looking through to the septum, making sure that there's no deviation or perforation. I will now check the patency. So Michaela, if you could please put your finger on one side of your nose and breathe in and out. Okay, and then move on to the other. So here I'm checking to make sure that both nostrils are patent, which they are. Next, I'm going to move on to the assessment of her mouth. I will once again start with inspection, looking at her lips, making sure that they are moist and pink and not dry or cracked. I will then ask her to smile. While she's doing this, I'm looking at her dentation, making sure that her teeth are white and that they are all present. And then I'm also going, once I have her open her mouth, I'm going to be looking at her hard and soft palates, ensuring that they are intact. I will be looking at her tonsils, making sure that they are not enlarged. I will also be looking at her uvula. So if you could please open your mouth and lift up your tongue. Here I'm ensuring there is no signs of oral cancer or lesions. And stick your tongue out. Move it from side to side. And then if you could say ah for me.
Ah.
And there I'm looking at that uvula, making sure it is rising up midline. Okay, now I'm going, if I had a tongue depressor at this time, I would do the gag reflex, placing the tongue depressor at the posterior part of her mouth. And these would be testing cranial nerves 9, 10, and 12. I will next move on to the neck assessment. I'm first inspecting her neck, making sure that there's no masses or notable nodules. I'm also looking for any jugular vein distension, and I'm going to do a couple of range of motion exercises with her neck, making sure that it moves freely. So if you could please lift your head up and down and side to side, and then ear to each shoulder. Good. And now I'm going to have you do that, and as you can see, her head is moving freely. I'm going to have you do this against my resistance, same exercises. Good. Good. And then head up, chin down. Okay. And then I'll also have you shrug your shoulders for me. And now I'm going to place my hands on your shoulders with resistance, shrug your shoulders. Okay, good. At this point, I'm going to assess her lymph nodes. So I'm going to start with the pre-auricular, posterior auricular, occipital, tonsillary, submandibular, submental, anterior cervical, posterior cervical, supraclavicular, infraclavicular, axillary, and epitrochlear. So while doing those tests, I'm looking for any inflammation of those lymph nodes, which would indicate an abnormal finding. I'm now going to palpate her trachea. As I'm doing this, I'm feeling for any enlargement, any tenderness. If you could swallow for me, As she's swallowing, I'm ensuring that the trachea moves up and down in a midline fashion. And now I'm palpating the thyroid, checking for any goiters. I'm then going to feel her carotid pulse, one at a time. And those are both 2+. I'll then move on to auscultation of both her thyroid and carotid arteries using the bell of my stethoscope. Okay, we will now move on to the anterior chest wall and lung assessment of the portion of the assessment. I'm first going to start with inspection, ensuring that her respiration rate looks normal. She's not using any accessory muscles to breathe. I'm then going to palpate her chest wall. If you could just let me know if you feel any tenderness. No? Okay, great. I will now palpate the precordium, checking for any thrills, heaves, or pulsations. I'm then going to locate the apical impulse and ensure that the heart rate and rhythm is normal. Okay. I will now check for tactile fremitus. So I'm going to place my hands on your chest. While you're doing this, I would like you to say 99. I'm looking for any absent or decreased vibrations, which would indicate consolidation.
99, 99, 99.
Okay. At this point, I'm going to move on to percussion. I'm going to percuss the chest wall, looking for dullness or hyperresonance. Okay. I will now auscultate her lungs using my stethoscope, the diaphragm of my stethoscope. I will move in a uniform fashion, assessing each lung as you take a deep breath for me. As I'm doing this, I'm listening for any wheezing, rales, or rhonchi. And now I will listen to her heart sounds. So I will start with the aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay. At this point, I'm going to ask Michaela to turn around, and we will now begin the posterior assessment of both her heart and lungs. Once again, I'm going to be assessing for her respirations, ensuring that she doesn't appear to be working to breathe with those accessory muscles. I'm going to palpate her chest wall. Any pain or tenderness?
No.
Okay. At this point, I'm going to once again test for tactile fremitus. So if you could please say 99.
99, 99, 99.
Looking for decreased or absent vibrations, which would indicate consolidation. I'm now going to percuss her chest wall, looking for dullness or hyperresonance. And there I was percussing both her posterior and lateral chest wall. I'm now going to palpate or to percuss the costovertebral angle. Any tenderness here?
No.
So that would be checking for flank pain or tenderness. I'm now going to move back to palpation, checking her thoracic cage expansion. So if you could just take a deep breath for me. And as you can see, my hands moved upward and outward in a symmetrical fashion. And now I will check your diaphragmatic excursion. So if you could take a deep breath for me and hold it. I'm going to percuss down and mark that point where I feel the difference. And then percuss up and mark that point where I hear the difference. And the difference between the two, that measurement would be considered the diaphragmatic excursion. I'm now going to auscultate her breath sounds. If you could take a deep breath for me. And again. And again. Okay. At this point, I will have Michaela turn around and lay down, and we will begin the abdominal portion of the exam. If you could just lift your shirt up just a little bit here. I'm going to use my pin light to inspect her abdomen, looking that her umbilical is midline. I'm also looking to make sure I don't see any pulsations, no contour changes, no protrusions. Okay. At this time, I would take my stethoscope and auscultate her bowel sounds. I'm going to check in all 4 quadrants, listening for up to 2 minutes until I hear a bowel sound. I will now listen to the pulses of her abdomen, starting with the aortic, right renal, left renal, right iliac, left iliac, left femoral, and right femoral. There I'm listening for any thrills or bruits. I will now move on to percussion of the abdomen, listening for any signs of fluid, which would be abnormal. I will now percuss the liver borders, starting downward and moving up. I will mark the difference when I hear, and then starting from up, going down, and marking that difference. I will then do the same thing on the left side, percussing the spleen, which should be not as easy. An enlarged spleen would indicate an abnormal finding. I'm now going to lightly palpate her abdomen. Can you tell me if you feel any tenderness here, Michaela?
No.
Okay. And now I will do some deep palpation to feel the different organs. Any pain? Okay. I'm now going to have you, as you lift your head, I'm going to be looking at the abdominal muscles, making sure that they are intact. Okay, and then I'll have you go ahead and sit on the edge of the bed. We'll now move on to the upper extremity assessment. If you could please extend your arms outward. Here I'm just going to first start with inspection, as always, looking that her skin is intact. There's no rashes or lesions or masses present. I'm going to feel her arms, making sure that the temperature remains the same throughout. I'm then going to look down to her nails, looking at her nail beds, making sure that there is no clubbing or signs of cyanosis. I will then do her capillary refill, ensuring that it is not greater than 3 seconds. I'm then going to have you turn your arms over for me here, and I'm going to feel your brachial pulse and your radial pulse. And the same thing on the other side, brachial pulse, and then your radial pulse. I'm now going to check active range of motion. I'm going to have you press up against my resistance here and down. And then if you can move your arms to the side and up against my arms and down. Okay. And now I will check your brachioradialis reflex. And you should see the hand just move slightly, and I would do that again on the other side. I'm now going to move to the assessment of her lower extremities. Once again, inspecting, looking that I don't see any rashes, lesions, differences in pigmentation, feeling the temperature, ensuring that there's no edema or pain. I will now feel her popliteal pulse, her tibial pulse, and her pedal pulse. And I'll repeat that on the other side. I will then move to deep tendon reflexes, starting with her knee. And then her Achilles. Just like her upper extremities, I'm also looking at her toes, making sure that there's no signs of any discoloration, any ulcers. I'm then going to do the resistance of her lower extremities. So if you could just extend your hand or your legs up here and push up against my hands and down against my hands. Okay, great. We'll now move on to the assessment of her cervical spine. While she's standing here, I'm looking at her cervical spine, making sure that it is aligned appropriately, and then I will have her bend forward. And here I'm checking the her thoracic spine, once again making sure that it is aligned appropriately. This will conclude my health assessment video for Maryville University. Thank you.